We welcome you back to Studio One, and we welcome Dr. William Kesto. Thanks for coming in. We're going to talk about meniscus tears today, meniscus damage. First of all, what is the meniscus?
The meniscus is the cartilage that's in between the femur and the tibia and the knee, and it helps to cushion the knee joint from the pressures of the weight bearing, and also provides nutrition through various blood vessel channels and networks to the knee joint.
We hear so much about damaged meniscus. Is this a particular area of the body that's prone to injury?
Very prone to injury. It's one of the most common injuries we see in orthopedics. Basically because as the meniscus, as we age, the meniscus dries and loses some of its nice cushion and suppleness. It gets a little more brittle, and with certain twisting injuries or movements, or even those weekend warriors, that it becomes more prone to injury and then causing a lot of pain in the knee.
The young athletes especially, seem to have this as something that's in the back of their mind. Are they more prone to it because of the nature of what they're doing?
The young athletes are involved in more physical activity. They're involved not just in the nature of their sports being more active, but they're doing it year round. And so that's the number of incidents, or just being more active for longer hours during the week and the year, puts you at a greater chance of hurting that meniscus.
How do you know that what you're feeling in your knee is not just like a little ache or a little pain or just some sort of twinge, but you've damaged your meniscus?
Right. And that's a great question. So with any big injury of a meniscus or a ligament, there's going to be a lot of swelling in the knee. That's usually an indicator that something is wrong, something is happening. Now, it may only swell slightly, and it may ache for a couple days and go away. If it goes away, that's typically just a bruise, contusion, or sprain. But if you start to get a repetitive swelling, or every time you twist or run a certain way, you get a sharp pain or a catch of the knee, that's definitely something that needs to be checked out. Sometimes the meniscus tear is so bad that it causes the knee to lock up, and the athlete cannot bend his knee or move his knee at all, and that's definitely an indication to get checked out as well.
There are different kinds of meniscus injuries too, tears and things like that?
Yes, absolutely. So there's something as the simplest form as a degenerative tear, usually seen in a little bit older patient, where the edge of the meniscus has gotten torn and frayed, and those are kind of simple problems. Then there's the tears that go all the way through the meniscus. Now, those are the ones that can cause pain or swelling in the knee. And then the worst kind is called a bucket handle tear of the meniscus. And that's when the whole meniscus is flipping in and out inside the knee joint. Those are the ones that cause it to lock up or catch on people. And those are usually associated with bigger ligament injuries as well.
How do you diagnose this? Is it primarily on the basis of imagery?
So our clinical exam can help guide us in the history of the patient, but definitively we would use an MRI imaging. MRI is very helpful in assessing soft tissues of the joints, especially the knee, and that's been really helpful for us in guiding patient care.
How do you, once you've determined that there is some sort of meniscus damage, how do you decide whether surgery is the right course? Because I understand in some cases, some of these injuries may resolve themselves.
Absolutely. So, if it's just a simple meniscal contusion, where we see on the MRI that the signal of the meniscus, the tear, is not going all the way through, or it's not a complex tear, a lot of these can be rehabbed through physical therapy, anti-inflammatories, maybe even a cortisone injection, and within 4 to 6 weeks it should be resolved. So that can help us. We also have a discussion with the athlete, with the patient, how they want to proceed with their care. Certainly some meniscus tears, the more complex ones, those should be fixed, and they have to be fixed. Because if you let that go and that meniscus gets further damaged, now we've accelerated the arthritic pattern in the knee. The joint forces are being dispersed and not absorbed by that meniscus, which is very protective to the knee joint.
The type of surgery that's done nowadays, now it's much more pinpointed than that, isn't it?
It's certainly come a long way. So now we have minimally invasive, all arthroscopic ways to fix the meniscus, basically through 2 small poke holes in the knee, through a camera, new devices coming out that allow us to create most of the fixation, all from the inside. Occasionally, we do have to create a small incision on the outside or inside of the knee, but that's getting more rare as we have new techniques to fix everything from inside the knee joint.
In terms of the prognosis, the recovery period, and what have you,
So surgery itself takes anywhere from 30 minutes to an hour. It's outpatient. And if we're just trimming or cleaning up the meniscus for those frayed and slightly damaged areas, that's a relatively easy recovery. 4 to 6 weeks of rehab, patient can be immediate weight bearing. We usually start therapy the next day. For those more complex tears that require a repair, a suturing of the meniscus together to preserve it and save it, we do limit the weight bearing of the patient. Again, for those 4 to 6 weeks immediately after surgery, to help that meniscus get its initial bind, its initial fixation. We are still starting therapy right away to work on the motion and work on muscle activation so the athlete doesn't lose his fitness. For the repairs, it could take 3 to 4 months to get back to sport. For the cleanup, or the meniscectomy as it's called, those are 4 to 6 weeks.
What does the Core Institute bring to this equation that makes it one of the best places, if not the best place, to have this procedure done?
The Core Institute, of course, employs sports medicine fellowship-trained surgeons. These are surgeons that have spent extra time, dedicated countless hours to arthroscopic treatment of sports injuries, specifically the meniscus. We also have standardized protocols that guide the physical therapist, no matter where you go, that this is the protocol. It's based on evidence-based literature and research to guide patients and athletes back to their fitness level and their sport, whether that's the young high school athlete going for a college scholarship or that weekend warrior.
Dr. Kesto, we've learned a lot. We appreciate it. Thanks for coming in.
Thank you, Mike.
Thanks for watching. We'll see you next time.